Well, today, state leaders confirmed 24 people have now died from COVID-19 at the Bethany Point Nursing Home in Madison County. And we know that 16 of them tested positive for coronavirus. The other 8 showed symptoms. Now, in order to contain this outbreak, health leaders tested every single person at that facility. But for the families of the 24 who died, it's too late. Tonight, our Emily Longnicker shares a warning from one of those families after seeing how quickly this virus escalates.
When stories about COVID-19 first hit the news,
I'm not going to lie, I was real skeptical. I thought, wow, there's a lot of overkill for illness. But then it just kept going and going.
Bob Reed knows better now. His older brother Bill died Thursday at a local hospital, an hour after Bob says the Vietnam veteran tested positive for the virus.
It's hard for me to fathom. I mean, he went so quick. I mean, that's what's mind-boggling to me is we talked to him at 9 o'clock and he sounded fine.
An hour later, Bob says everything changed.
All of a sudden, he couldn't breathe on his own.
I kept telling him, Bill, just fight. I know you're a fighter. Fight.
4 hours later, though.
It just makes no sense.
But a week before, Bill had been released from Bethany Point Health Campus after doing rehab there following another hospital stay in February.
My brother wanted to leave, and he signed the papers to leave.
Bob says he didn't think it was a good idea, but says the facility let Bill leave because he didn't show any signs of the virus, despite other residents there already testing positive. 4 days later, Bill went to the ER with symptoms.
Monday, the same day that Bill Reed was admitted to a local hospital with pneumonia-like symptoms, the state announced 11 deaths here at Bethany Point from COVID-19. 4 days later, a grim update, the total now up to 24.
This is a tragedy for the families. It's a tragedy for the healthcare staff that grew close to these residents. It's a tragedy for our entire state.
At a smaller level, a tragedy for Bob Reed and his family.
Whenever he had a problem, he called me.
Unable to even say goodbye to his brother in person, now unable to have a proper funeral for him. That will have to wait until Indiana's stay-at-home order is lifted.
Wasn't a walker.
What's lifted now, though, the veil over Bob Reed's eyes about just how lethal COVID-19 can be after its devastating consequences hit right at home.
Now my eyes are so wide open.
Our hearts go out to all of the families who have lost loved ones. Just this week, the State Health Department issued new reporting requirements for nursing homes. They now have to report all positive test results and coronavirus-related deaths to the state within 24 hours. The peak of this coronavirus pandemic could hit Indiana earlier than we all thought. A couple of days ago, you probably remember us talking about this one model that projected that April 16th would be the peak in Indiana. But now the Institute for Health Metrics and Evaluations has moved that date up to Monday, April 13th. That may not be too surprising because we've seen a sharp rise in the number of Hoosiers being infected and dying from coronavirus. In fact, today alone, we set a new record with 55 Hoosiers dying. Let me go ahead and put this in perspective here in Marion County. We've had 107 deaths from COVID-19. Up in Hamilton County, we've had 19 Hoosiers die. Down in Johnson County, 16. And one of the other trouble spots across our state in the Northwest region, Lake County, with 23 Hoosiers dying from the coronavirus. And today we got some more demographics to see who is the kind of person here in Indiana that is catching COVID-19. The pattern in our state is pretty similar to most across the country. African Americans are dying from the virus at a disproportionate rate. Here in Indiana, African Americans make up about 10% of our state's population, but they account for more than 19% of the COVID-19 deaths. That's largely because of existing health disparities, making African Americans more susceptible to things like heart disease and diabetes. So the numbers on this board are pretty upsetting. I mean, you've got 6,907 Hoosiers infected with COVID-19 and now 300 deaths statewide. But state health leaders say the most important thing that all of us can still do is maintain that social distancing.
It's hard when we have this many people dying to be real positive. But I know that we are going to do everything, and we are doing everything that we can to dampen the number of lives that we lose in the state of Indiana. And I know that we've got a great Hoosier population that is doing a lot to take care of each other.
Tonight, let's focus on some of the positives we're seeing. Eli Lilly just announced the start of clinical testing for a potential treatment for the coronavirus. Tonight, they're looking at the medicine currently used to treat rheumatoid arthritis. They should have those first results within the next 2 months. Also tonight, a local hair care manufacturer is stepping up since first responders are really struggling to keep a steady stock of protective supplies. Mansfield King is now using all the alcohol needed to make hairspray and making hand sanitizer instead. So far, the company tells us they've donated 50,000 bottles to healthcare workers and police departments, and they plan to donate another 50,000 next week.
I would have probably written them a check, a personal check, just so I can get enough for my family and for the guys I work with. The fact when I read where it said not for sale, that touched my heart. That was awesome.
And take a look at this. More than 100 signs of support for healthcare workers on the front lines tonight. Staff members over at IU School of Medicine started this effort, bringing positive messages to ER docs. They posted a request on Nextdoor asking Hoosiers to drop off signs, and boy, people have responded. In fact, people of all ages have answered the call. If you're interested in helping out, we have all the drop-off info posted on WTHR.com.